The STEPS 2023 National Health Survey is a tangible output from my core ministerial team to address the lack of key data and pertinent local statistics of a public health nature. The data from STEPS will allow us to determine the national prevalence as well as the risk factors for non-communicable diseases within the Cayman Islands.
Non-communicable diseases, or NCDs, are diseases which are not caused typically by acute infection or passed from person to person, as infectious diseases are. Whilst there are genetic factors associated with NCDs, these diseases are usually linked to lifestyle choices and behaviours. Globally, non-communicable diseases like cardiovascular disease, cancer, diabetes, and chronic lung disease are the leading cause of mortality and disability. These conditions require long-term care and treatment, severely impacting an individual's quality of life.
We know that heart disease, cancer, diabetes, and respiratory illnesses are responsible for the majority of deaths within our island every year. But to date, we still do not know the true impact of non-communicable diseases within our shores. The cost of not knowing is simply too high, and one which I know we are all unwilling to keep paying.
In 2012, the Ministry of Health undertook the STEPS National Health Survey, and those results, albeit outdated, remain our key data source for the national burden of NCDs in the Cayman Islands. The STEPS 2012 survey found that 41% of the population had raised blood pressure, and 37% of the population were obese, with an additional 33% of the population being overweight. While STEPS 2012 provided us with valuable data, there are still gaps that we must rectify. For example, we do not currently have the scale for high blood sugar in Cayman.
Through repeating the survey, we can see how the population's health has changed in the last decade.
The results from STEPS 2023 National Health Survey will allow us to prepare and plan relevant policies for our people and inform us as we work to update the National Health Policy and Strategic Plan for Healthcare, review and update relevant legislation, and prioritize key areas of prevention and treatment to strengthen our response. Data collected from the STEPS 2023 National Health Survey will shape Cayman's healthcare services for years to come, and has the potential to positively impacting generations of Caymanians and residents. Think about it. A data-driven approach to decision-making allows us to focus our resources where they are most needed, prioritizing not only relevant and effective treatment programs, but also prevention and education programming that, where possible, stops these non-communicable diseases from becoming an issue in the first place.
The STEPS 2023 National Health Survey is long overdue, and the results from the survey will give us the opportunity to adopt data-based health policy founded on recent and robust health indicators. This survey will provide insights into the groups within our population currently most impacted by NCDs, allowing us to tailor healthcare interventions to meet their needs. It will also assist us in understanding the current barriers to healthcare, particularly preventative care, and how those barriers can be mitigated.
We are doing our part, but we cannot do it alone. The quality of the data we collect is based entirely on community participation. Will you help shape Cayman's healthcare?